Carol Baden from the governor's office is going to kick it off for us today. Carol and I have been working for about 6, 7, 8 months now. We met, been doing several presentations together. A lot of the initiatives that she'll talk about, I think, is very relevant to what we call our substance use prevention program as well. And I know you've heard me talk about that before, and I'm going to go over it in a little more detail today after Carol presents. But let me introduce Carol Baden. She serves as the Community Health Advisor for Recovery Ohio, a Governor DeWine initiative aimed at combating substance use and mental health disorders, recovery support, in collaboration with law enforcement. With experience in healthcare, nonprofits, and state government, Carol is committed to expanding access to quality of care. She is a certified trauma response care coordinator with a background in nursing and public health. Carol advanced health access by promoting harm reduction, collaborating with national partners. She's part of the core team for Stepping Up Ohio and serves on the Ohio Healing Community Study. Carol believes that every individual has a unique purpose and that community well-being begins with personal wellness, a value shared by her and her family. So let's welcome Carol Baden.
So Carol Baden, I've been with Governor DeWine since he was at the Attorney General's office in 2015. I got hired because I had started a nonprofit, done some work in my own community, which is Hamilton County, kind of spread through that region. I don't know if you've heard of the QRTs or quick response teams, but I helped start the first one. And when I went to interview with the governor, who was then AG, he said, "Can you take that program across the state?" I'm happy to say we now have 70 of those teams across the state of Ohio. So, and they do a lot more than just post-overdose response now. They really get embedded in the communities. We hear a lot about public safety and community policing and all these things. That is truly the deflection model that is working in the state of Ohio and has expanded to other areas across the U.S. because it's a model that works. So I just want to talk a little bit about a study that was done, a really impactful study. Now, my husband read my notes yesterday after I had him print them off, and he said, "I didn't realize that we had this many people in the U.S. who self-identified as having a substance use disorder." From this survey, we learned that there are 22 million adults in the U.S. who are in recovery from a substance use disorder. Of those, 80% are full-time employees. In Ohio, we've got 5.5 million people who identify as having or who are employed. 19.2% of those folks, or 1.7 million people, report having a substance use disorder. So when we look at those numbers nationally, 61% of adults in the workforce say, "I have had a substance use disorder." That's why this program that we started in August of last year is so impactful. I have worked alongside these communities. I've been in little towns and big communities across the state over the last decade and seen the impact of drug use, mental health challenges, and I've also seen these communities really rise up and take charge and responsibility to get their citizens on the right track, right, and make sure that people are feeling supported. I really want to give a shout out, thank you to Centerville Police for hosting you all here and for doing this. When I was at the AG's office, I have presented next to Phil Plummer, who was the sheriff at the time. We were at the public library here doing a presentation, and this is my 90th presentation in the state for this topic. So I'm on the road a lot, and I see a lot and hear a lot about what's happening in our communities. So I'm going to share a little bit of this with you today. So at Recovery Ohio, our little team was charged with making sure that every state agency works together, right? When we came into the governor's office, we had a number of state agencies who were not working on the health and well-being of the citizens across the state. Their priorities were very siloed, just as we had seen in the communities, right? So oftentimes we saw health completely isolated from public safety. This really hurt my heart because I was a nurse, and I know that the emergency rooms, public safety used to be best friends, man. Like ERs in the middle of the night, they were over there sharing cups of coffee and talking about what they'd seen and done. And that was a lot of space for people to really cope with mental health struggles that they might be having. And then the opioid epidemic hit, and everybody was pointing fingers and saying, you're not doing enough, you need to help more. And we became more siloed. And so by telling the state agencies we're gonna all work together, we drove that down to the local level too, which is where my passion is. The partnerships that have been developed over the years through the opioid epidemic, through COVID and mental health challenges, has really been exceptional. And I'm proud to say that a lot of the programs that we started are going to be sustainable after we're gone, which will be in January of 2027. So why are we doing this? We really want to combat stigma. We want to emphasize that employers have a role in helping their workplace be a place of well-being, right? When I first started this program and I was going out and talking to employers across the state, oftentimes I would hear, well, we don't have that problem here, or our policy hasn't been updated, we're fine. Well, you're not fine, because you probably have somebody that is chronically tardy, someone that's on personal calls too much. Do you have an open door policy with your HR department? Are you allowing folks to come in and say, I'm really struggling today, I got to take the afternoon off for whatever reason? Might be for them, might be for a family member, right? So we also want to emphasize this isn't just about hiring people in recovery, which I will say is a large, untapped resource for our employers across the state. So we need to think intentionally about both of those aspects. And when it comes to policy, Kathleen is going to talk a little bit about some of the programs that BWC can offer in that policy development and policy update. If you don't have a policy in place, you're probably in a bad situation when something comes down the pipeline. And of course, workplace safety is key. That is the most important thing. And by having people that we support in their well-being, and if they are struggling, to pull them off of the employment line, whatever that looks like, and say, we're here to help you. We want you to stay the course and be with us long term. And there is accountability, right? So getting into this space 13 years ago, a lot of folks were saying, well, you just excuse the drug use and the behaviors. That's not the case. Folks in recovery are taking accountability and responsibility for a lot of their actions that they took on during that time of drug use. And also with mental health challenges, right? So recognizing that recovery is possible, it's different for everyone, but we need to start embracing this sector of the population as workforce. These are some pretty powerful numbers. If I can't sell anything else, I can sell that you as an employer can save money when you take care of your workers. And we know that people who are in recovery have fewer sick days. They show up to work on time. They're willing to work extra. They are saving their employers money. When people have unmitigated substance use and mental health challenges, you're going to lose money. So again, like I can talk about all these other things and give a hug and touchy-feely, but when it comes to that bottom line, sometimes that's what hits the employers the hardest, to say that they could be saving some money. So when we get into the program itself, again, we started this August 30th of last year. I was asked to lead this program for the state, for Recovery Ohio. Fortunately, I met Kathleen. We were at a chamber meeting in Dayton, and the information that she presented dovetailed so well with what I was presenting. We partnered up through the rest of the year to really share this mission. And again, we're sending a message. And I will tell you, I'm really thankful that my slide deck is working today. I have a presentation coming up in September at the BWC conference, and I'm co-presenting with two other people. One of them is going to talk about substance use and mental health and the impact on the brain and body, all of those aspects. And the other one's going to present on BWC. And they sent me my slide deck yesterday that they had combined all three together. And they said, please review. And when I opened it up, it was in Spanish. So always review, always review. So the program itself, first off, we want to look at what you can do to really provide that support. Mental health and well-being for behavioral health is every bit as important as physical well-being and physical health. I can attest to this personally. In February of 2024, I fell and broke my wrist. I was in Miami, had to fly back to Ohio, have surgery, and I had 3 months off work. And not one person, even on my own team, ever said, are you okay? How is this affecting you? Right? And I'm like, wow. Do we think about physical injury and the impact on mental health? We don't. So we really need to think about that also when we have a workplace injury. The access to help. So I'm here, I'm in other communities, Kathleen and her team, we're all across the state. But at the end of the day, if you have an employee that is struggling with something, who are you going to call? It's not going to be me. I'm not a provider. Because I've been all across the state for the last 10 years, I know providers in every single county. So when an employer submits their designation to be in this program, I can help you get connected to your local treatment and support for an individual and family. And that has happened. I've reached out to a couple of folks that I wasn't familiar with who signed up for this. And I said, tell me, how come you signed up? Well, we had an employee with a positive screen last week. And my boss said, do something. And so I was able to get them directly connected to the local mental health and recovery board to find a provider for that individual. And something else they did, it was a trucking warehouse company, kind of that middleman manufacturing. They posted the 988 number in every trucking bay. What's the significance of that? 24/7, a person is on the other line. It does not have to be a crisis. I know people who have called that line to say, I'm just feeling really lonely. I need somebody to talk to. The volume of calls that 988 has had is unbelievable. And I know a young man who has called multiple times. He was suicidal. He called. He got assistance. He was admitted inpatient to get the help he needed. But every time he calls back, he's on the spectrum, they give him to the same person. And that person on that line was okay with that. They said, nope, I want to help this kid. I want to help him stay stable. And so he's got this connection now with this 988 line. It's pretty cool. So then we talk about the community partnerships, just talked about that. Know your local mental health and recovery board. Know your local public health office. Know your local providers. They're going to be your go-to when crisis hits. We want to encourage employees to engage in recovery content. What does that mean? Back in 2021 and 22, our unit partnered with Addiction Policy Forum. I became a certified trainer. And during that time frame, over 18 months, I did 21 8-hour-long virtual trainings on addiction and mental health, treatment, recovery, all things, and self-care. Luckily for me, after those 21 trainings, I told my boss, please get me help. Nobody wants to listen to me for 8 hours. So we got some help. We now have 100 trainers in the state of Ohio who can go out, and it's a condensed version, 2.5 hours. We just did one of these for the Ohio Department of Aging. It was phenomenal. And they're like, we want to do more. What more can we do? So that's just one example of the trainings that are available. Let's see. Policy. We already talked about policy. Kathleen and her team will talk a little bit more about that. Please make sure that you are sharing the importance of good policy for substance use and mental health. We have a lot of second chance employers in the state. They have good policy in place. If you ever need examples of policy, we can get you some. There's some really great templates. And I know that SHRM also offers some really good templates for policy development. Leadership education. There's some modules that the Ohio Chamber developed to talk about how to have the conversations with folks who might be struggling, what policy development looks like. Can you be a second chance employer? So we want to make sure that those impacts you're being supported in case you need to address those impacts. Let's see, alternative support options. So what about wellness, right? So we really need to think about utilizing all of these resources. Again, Recovery Ohio is going away in January of 2027. I want to make sure that much of the work we have done is sustainable, which is why I'm doing this road show and talking about this in our other programs. Okay, so these are just a couple of things that we have done in the state of Ohio. Obviously, the pledge to end stigma. Stigma is still awful, quite frankly. Stigma kills people. Learning about addiction and mental health challenges is so important, and we need to start really thinking intentionally about what that looks like. I don't know anyone that hasn't been affected. It used to be I would give these presentations back in 2015, 16, and I'd say, who has a personal connection with someone who has had a substance use or mental health challenge? And maybe one person would put their hand up, and now it's like 10 out of 10, right? If you don't know someone, you're lucky. So these are some of the things that our employers who participate receive. There's some digital media. You can put a note in your newsletter, use the logo, the flyer and the graphics. I will also say that it's also the connection to other state agencies and local agencies that can give you assistance to share that you are a recovery-friendly workplace. The governor would love everyone to take a closer look at expedited pardon. There are a couple, but only a couple, exclusions from this program. We have a huge population coming out of the prison systems. If we really do believe in rehabilitation and correction, we need to start thinking about things like second chance and expedited pardon. I have an organization, a big company in the community where I am. 90% of their employees have a felony, and they have a fantastic workforce. And what they do with them is bring them in and upskill them so that they can go out and do other jobs, so that they can make that living wage. So we'd like you to join, obviously, our recovery-friendly workplace. It's easy to go online. If you pick up my card up here, on the back is a QR code that takes you directly to the website. Currently, I have 125, I'm going to say, employees across the state who have signed up. Once a month, we publish that list. We put that list out on request. So obviously, I get a lot of emails between these employers and the other programs that I'm working on for the state. So send me an email if you want to see that list. So it'll be updated again July 1st-ish. I'd like to say it's always on time, but our comms department is busy too. So, but we have the opportunity with some larger and smaller employees to celebrate them, celebrate recovery-friendly workplace. So on August 31st, every year, I've done this for 8 years now, we partner with the Cincinnati Reds to host an overdose and recovery awareness baseball game, pre-game event. And so we're doing that on the 31st. We're going to honor 6 people from these recovery-friendly workplaces to stand down on the field pre-game and to thank their employers for believing in them, believing in this program, and for believing in employee well-being. So it's a really cool thing. I just heard back from one of the agencies that we had selected to designate someone. And they said their employee cried. He said, things like this don't happen to me. He's in long-term recovery. He's been stable in his job and in his recovery. And so guess what? Things like that can happen to him. So we're going to have him down there on the field pregame. And the Reds take a bunch of pictures, so he'll get access to all of those as well. Lots of conferences and things coming up that we're going to be speaking at. Lots of opportunities for us to share all of the information that we have. This is a list of some of the other programs that we work on. So when we look at the Recovery Ohio team, we have had our finger in a number of these things over the past 10 years. We would look at naloxone.ohio.gov. You can go online, look at a short video. It's mailed right to your home, a free naloxone kit. The counterfeit pill campaign, obviously you hear a lot about, the counterfeit pills on the street. They look like Percocet or Xanax. They're actually fentanyl. Not a good thing. Beat the Stigma campaign. I don't know if any of you saw that on TV. I got to see it during the Thanksgiving Day parade. They actually showed it on one of those. It's a fun little campaign to go on and use to just say, how much do you know about addiction and mental health challenges? We talked about the toolkit that you get. I would encourage you to go online and look up our media resource guide. It was obviously originally designed for media to talk about folks with addiction and mental health challenges compassionately. Watch your words. There's a handout up here that says the same thing. And I think we should all employ that in our workplaces as well. 988, I mentioned, massive rollout a couple years ago, and they are about to do a big upgrade as well. So make sure that folks know about that 980 number. There's a handout up here, and it's the headline on it is, I'm fine. That's me. That's me. I always say, I'm fine. I'm fine, especially when I'm having an argument with my husband. I'm fine. Step away. Let's see. Operation Bridge. I love this program. So because I worked at the AG's office, we partnered a lot with law enforcement. And so I still have this passion for partnering with them. I taught a number of law enforcement agencies across the state how to use naloxone. And I am so grateful that they decided to do that. We hosted multiple conferences. We wanted to host conferences for faith leaders, but since we were at the AG's office, we had to include law enforcement. So we would have 700 faith leaders and 300 cops all in the same room. It was a lot of fun. But Operation Bridge is a program that was born several years ago. I helped start up a retired highway patrol officer said, hey, I want to do something more for this, what we call community policing. So how can we get public health and public safety together to work on similar programs? So what we do is across the state, communities will pick this up. We have drug court, prosecutor, law enforcement agencies, highway patrol, local sheriff's office, and then we bring together all of the resource providers, treatment support, family support, the BMV, so people can get state IDs. And they'll host a 1 or 2 day event. Part of it is a resource fair for folks in the community, and they set it up in an area that's high traffic, high foot traffic, and where they know a lot of folks that might be hanging out under overpasses or nearby, right? And so they bring in food and they help folks get connected to some of these programs and some of these resources. At the same time, not advertised, there's an interdiction event going on. And the law enforcement is serving warrants. They're going to known drug houses. They're doing traffic stops. And when appropriate, someone with a lower level felony or misdemeanor potential charge is invited to partake of treatment that day. So what they can do, because we've got these treatment providers set up for this, they can get immediate access to an assessment and treatment. And it starts that day, not we'll see you in 3 weeks. I was in Clermont County yesterday. They did one of these. I was in Licking County last week for theirs. We have seen as many as 30 people get connected on that day to immediate access for treatment. And you go, well, yeah, but then they're just going to bolt. They're not going to stick with it. Lawrence County was the first one we did. 31 people that day got into access for treatment and care. 6 months later, 19 were still in treatment. The sheriff's office thanked us in Ross County and said, I haven't had a single overdose in the jail in 2 weeks, the 2 weeks after this event happened. And I was having an overdose in the jail at least every couple days. So we're helping our communities take charge. We're helping them reinforce that you're not going to be able to do this alone. Partner up. Make sure you're partnering up for this. That's one of my favorite programs. In Columbiana County, they fed 800 people. They did it in a church. Folks were coming through. They had 2,000 people. This was about 10 minutes away from New Philadelphia, about 6 months after that incident. I learned a lot from that. I learned a lot from those people, and I learned a lot from community. They had the school kids making turkey. It was at Thanksgiving, turkey placemats. The church put flowers on the table so people felt like they were really being served a good meal in a space where they could come and get some resources. So as you can see, I'm really passionate about some of these projects. OH Against OD, that's a big one that's out there again. They just revamped that. And the Stepping Up Initiative is the mental health courts in the state of Ohio. Justice Stratton now has those. I want to say there's 88 Ohio counties, and I think we are beyond 65 Ohio counties who have taken up this special docket now. And I will tell you, the impact on veterans with these dockets is outstanding. She's a real advocate for veteran services. She doesn't want money left on the table when a veteran comes through the court systems. And so she's really put in this structure to help with that.
You know, of the 125 companies that you mentioned are currently in the program, can you describe the breakdown? What is construction, manufacturing?
Yeah, we really expected it to be mostly like treatment providers and nonprofits. I have JBM Packaging, I have Bechtel, I have Smurfit Westrock. We've got some international companies who have signed on. We also have some, in the case of this man who said these types of things don't happen to me for the Reds game, that is a second chance employer in the Dayton area. So we've seen quite across the board. I have a union that signed up. So yeah, I think those agencies have seen the impact and they say we want to do better.
Along with Tom's question, do you do any outreach to the construction industry in particular? Because
Yes, construction industry is
lately have been
absolutely. So we do, and I've reached out to the unions and had conversations. I mean, at the end of the day, this has to go through a chain of command usually, especially in some of those industries. And oftentimes it gets stopped at a certain point, like, no, because then we'll have to redo our policy, or nope, we can't put out there that we have these people working for us. And I'll tell you, my husband is a financial advisor, and he said in his business, nobody's going to use this because they don't want it out there that they are hiring drug addicts, right? And so that is the challenge. And I think by getting the information out about the impact of doing nothing, and also how many people are actually existing in this space in recovery. So yeah, I think that's going to be key. Anything else? No?
I do have a question.
Yes.
So with the HIPAA laws, and how do you speak to one of your employees that you think that they might, you can't ask,
Sure.
that, how do you start that conversation?
So that is in the training that I described that's called Responding to Addiction. We actually have a module in there that talks about how do you have that difficult conversation. When I was doing that training, the 8-hour long one, we had doctors who were sitting in on it saying, I can't have that conversation with my patients. It is a red-faced conversation. I think opening the door to the conversation to say, hey, we notice there's something going on. Come on in, let's sit down and talk. And I think just, again, like continuing to open that door. When you come from the vantage point of addiction is a disease and it affects the brain and all of the body systems, basically, you have the power of science behind you to say, look, I get like those neural pathways are being rewired. Your decision making is not what it could be. We need to talk. Workplace safety is first, right? And second, we care about you. We want you to get out. We've got programs in place. We have local providers that we've connected with. What can we do to help you?
Well, we're union,
Mm-hmm.
so when you mentioned the union.
Yep.
It's very often that we try to hire union guys and they can't pass drug tests.
Right.
Number two, they don't have a valid driver's license
Mhm.
because of past history in driving. So my husband's been in the union for over 40 years. And how many people he's lost from alcoholism, drug overdose.
Yes. And alcohol's
When
still
you
the
said
number
union, I'm
one.
like, you guys really need to get in there.
Yep.
Because it is bad.
It is bad. And
Yes.
alcohol is still the number one killer.
Yes.
And I've had officers say to me in some of these communities, some of the things they've seen. They said, we have a bad day, we buy a 12-pack, kick the dog, beat the wife. Yeah, that was from an officer.
Yeah, there's
Yeah.
a lot of them that have their background checks come in with, domestic violence, OVIs.
Yes.
I mean,
I actually presented
my
a few
head.
years back to a manufacturing group, and they told me, we don't test for marijuana anymore because everybody smokes. And I was like,
Yeah.
oh, and they're driving your forklifts, right? So,
or,
right,
a vehicle down the road.
right.
So,
So yes, we are working on I've had conversations, and again, I'm going to push the envelope a little bit. Our lieutenant governor is really entrenched in workforce. And so I think that is a great place for us to lean in a little bit harder.
and we do free drug testing. The union does it. They say it's up to you. If you want to drug test these people, and I have to. I want a background check, work schools.
Yeah, don't
work hospitals.
compromise
I'm not gonna
safety.
take a chance. I mean, I just had 4 guys randomly drug tested. So I pull them in. I don't know if any suspicion or not. I want to know.
Mhm.
I send them down, and they've all been clean.
Yes.
knock on wood. So
Well, that's good. That's a win.
it's a win. Yes.
So Carol provided a lot of good information about some of the services that they offer. And I know I've been out here talking about some of the programs that we have as well. But there's been a major change effective July 1st to our drug-free workplace program or drug-free safety program and our substance use recovery and workplace safety program. We merged these into one program. All of the elements are still the same, but let's talk about each one of those programs separately before we kind of get into the nuts and bolts. So 1997, BWC implemented a discount program or a rebate program to incentivize employers to implement drug-free workplace programs. One of the things we wanted to do way back then, we wanted to give that incentive, that rebate, that discount to incentivize that because that's helping us with workplace injuries on the back end. That was the reason. But we didn't want to wave that carrot to the employer to get them to sign up for that rebate, to get some money back from BWC, and expose them to other liability. So that particular rebate program is very specific. You have to have a policy that's very detailed as to the who, what, when, where, why, how you drug test. You have to do supervisor training, employee education, You have to obviously do drug testing. Depending on what level you're in, you might, if you're in the advanced to get the higher discount, you would do random drug testing. And then also some form of an EAP. You know, in the basic level is just providing that list of providers who provide services. When you get into the advanced, you pay for it either through your healthcare insurance or out of pocket. So that program has been pretty successful, and that is still in effect. It's changed its name. Our new program is called the Substance Use Prevention and Recovery Program. So the new acronym is SUPER. So we also had, and I know I've been out here talking about this in the past, separately our grant portion, where we will pay for some of those services. And so that has kind of been, both of those have been rolled into one underneath the same umbrella as SUPER. But what I probably wanted to concentrate more on is still that grant portion of it, the reimbursement that employers are eligible for under the SUPER program, and not so much the discount. So we will pay for these services. You can see policy development and legal review. As Carol mentioned, that policy is key for an employer. That helps tell your employers, like I said before, the who's going to be drug tested. You know, how is it drug tested? When is it drug test? You know, are you doing pre-employment, post-accident, reasonable suspicion, follow-up to treatment? We encourage you to keep them, give second chances. We know some are not able to, maybe because of union contracts or maybe because of the type of work that they do. Maybe it's safety sensitive. But as Carol mentioned, a lot of these individuals are already working for you. So having that robust policy is important. We are not experts at PwC. We can tell you a lot about claims, but we're not legal counsel, employment law specialists. So we encourage you to use a policy development or your legal counsel. There are so many things that go along with a policy. You might have a call-out policy. You might have an accident reporting policy. If that person is going to be drug tested, you want to make sure you have a pretty solid accident reporting policy, because you want to make sure that they report that so you can get your drug testing done in a timely manner. You might have union contracts or other company policies. So that's why, you know, there are cookie cutters out there, but it's really important, I think, for you to use your legal counsel or your policy developers. They will walk you through a drug policy and get your input in making sure that it's customized to you. We will actually pay for that as part of this grant. The supervisor training and employee education, many employers will do that. I hope that if you're doing reasonable suspicion drug testing, that you've trained your supervisors on how to do that. How do you approach somebody? How do you recognize that somebody's under the influence? You want to have a substance use professional do that training, because they're the ones that are in tune with what's going on out there. You know, they're the experts on you know, how to recognize somebody that is under the influence. They will train your supervisors on how to document that. How do you approach somebody? How do you get them to the testing site? What do you do with the results after that? So that is something I think that needs, again, to be done by an expert, but we will reimburse for that. Employee education. A lot of times that's just, what does your company policy say? What are you testing for? What drugs are you testing for? When is the testing occurring? Are you using a certified lab? All of that employees need to know. Many times, and we do this at PwC, we'll get an employee handbook update. We have to check that we've read and received and read the update. And, you know, it's on us to actually do it. But does your employees know what your drug policy says? I will tell you right now, with the changes in recreational marijuana and then medical marijuana in the past, you know, I think some of your employees, most of your employees, are probably making assumptions on whether or not you test for marijuana, they're allowed to use marijuana, all of that. So, you know, that again goes back to a little bit of the policy development. But have those conversations, again, by somebody with a substance use professional background. somebody that knows what's going on out there. We will pay for that. We'll actually pay for these last two have to have a second chance agreement. The first two, you do not. But we will actually pay for drug testing, whether that's new hire, pre-employment, post-accident, reasonable suspicion, random. We will actually pay for your drug testing if you have a second chance agreement. What is new to the program starting 7/1 that we're excited about is we will pay for the substance use assessments. I think Carol kind of mentioned this. Many times if there's an employee and you have a second chance and you're retaining them within your employment, you're going to want to make sure they have a negative test before they come back to work. But you'll want them to be assessed, to be able to know from a substance use professional again, whether that person slipped up one time, have more of a long-term issue. Are there other factors that are playing into that? And many times, and we see this a lot in construction, I think to Will's point earlier, in construction, a lot of times they just leave and go to a different employer, and then it's somebody else's problem instead of getting into treatment. So if the employer pays for that up front, then they can ask for reimbursement from BWC for that substance use assessment, and that again is new. I've been out here talking about the program before, and if you've been here before, you recall there was different buckets, so much for policy development, so much for drug testing. All of that's gone away. Now it's just a maximum of $5,000 per year. You can use that in any way you want. You can use it all for drug testing. You could use it, some for policy development, some for supervisor training, some for each and every part of that bucket, or maybe in one of those categories. So we wanted to kind of take those caps away and give you the ability and the flexibility to utilize that dollar. $5,000 each year, that's reimbursable. You do have to submit your reimbursements within 1 year from the date of service. So if you had a drug test done today, you would have until July 17th of 2026 to submit that for the reimbursement. And now with the new program, we have an online portal. So that's going to make it easy for you to submit your reimbursements. You do have to be a state-funded employer. So if you're self-insured or a state agency, you don't qualify for that because you have to pay into the state insurance fund. And then you also have to be in good standing. So paying your premium on time and your true up that is due right now for private employers, all of that has to be in place. Just like any of our other programs, you have to be in good standing. But this is a great opportunity. I'm excited that the new program offers a lot of flexibility, and hopefully that will encourage more and more employers to participate. With this portion, with the reimbursement or the grant portion of the program, it doesn't matter what other program you're in. If you're in our old drug-free workplace program, which is now part of this program, you're certainly doing these activities anyway. So you should be asking for the reimbursement for those activities. But if you're in a different program, like a group retrospective rating, that's not compatible with that old drug-free program, but that you're still eligible for the reimbursement. So again, as long as you're not self-insured or a state agency and you're in good standing, you qualify for at least the reimbursements. So this really, I think, is something that probably everybody in this room qualifies for, most everybody in this room qualifies for, and really encouraging you to take advantage of it and getting those reimbursements.